Welcome back. If you get dizzy doing something as simple as bending over or rolling over in bed, then you may need to see a doctor. You may have a condition known as BPPV. Dr. Lana Joseph-Ford explains in this week's Healthy Habits with Dr. J.
Hey guys, it's Healthy Habits with Dr. J, and today we are talking about dizziness and balance. Joining us today is Associate Professor and Director of Slew Care Audiology at St. Louis University, and also, fun fact, my former supervisor during my doctoral rotations, Dr. Dave Harris. Welcome to the show, Dr. Harris.
Thank you for having me, Dr. J.
Thanks for being here. So I know there is a big question that a lot of my viewers are wondering today, so I'm going to ask it on their behalf. Why is it that sometimes when we get out of bed, we get really, really dizzy?
Well, usually it's because of what's called BPPV, or benign paroxysmal positional vertigo. And what that is, you have these crystals that's floating around and stimulating your hair cells, and it gives you a quick sensation of vertigo or spinning sensation. Usually it happens when you're either rolling out one side or the other, when you're looking up or bending over.
So back it up. You mean to tell me that we have crystals inside of our head?
Yeah. So it's called Odoconus, and oftentimes you may hear an ENT may refer to it as rocks in your ears. But what that's doing, when it gets loose, it stimulates the hair cells and is doing what it's not supposed to be doing, and you get that sensation of vertigo. And what vertigo is kind of like you're spinning around, spinning, and stop, and everything seems like it's moving. That's vertigo.
And I know from my patients at my office, and I'm sure I know you see it all the time, but we will see them come in, they'll complain and they'll talk about dizziness. They don't necessarily relate it though to something that's a real condition or an actual problem. So I know at SLU, you guys work very, very closely with patients in otolaryngology about dizziness, about balance, and dizziness disorders that are associated with other things. So can you just tell us a little bit more about some of the ways that you treat and diagnose BPPV?
Right. So we always start out with a hearing test, because that can let us know whether if it's vestibular labyrinthitis, neuritis, Meniere's. So there are various different types of balance-related issues that's related to your hearing. And then after that, we actually do a full balance test. So with that, we want to do some of the central auditory testing, central nervous system testing, and that's doing ocular motor types of testing, so following a dot. And then we look at the peripheral system. So that's when we actually would determine if someone has BPPV.
And those are a lot of big words. So let's break it down a little bit for our viewers, right? So when you talk about ocular motor, you're talking about what exactly?
So we're looking at your eyes and your ears, or your balance system, all works together. So your ocular motor system allows you to pick an object like a car driving down the street and follow it with your eyes. So that's a part of your balance system. And if that's not working right, then that tells me there's something wrong with your central nervous system portion of your balance system. The peripheral is basically your ears.
That's right. So our ears are connected to our eyes and ears are all connected to our skeletal muscular system, which is just the bone structure and all of that. So tell us a little bit more about, I know you've mentioned before about migraines, we talked about vertigo. Tell us a little bit more about how all of that is connected, and how would a patient come to you, or should they come to you to treat any issues that are associated with balance?
So when we take a careful case history, it kind of determines a lot. So when someone has what's called vestibular migraines, whether you have physical pain in your head or not, can cause you to feel a little off or feel vertigo, actually. So a lot of that is determined through case history, and then some of the testing kind of weed out some other things.
Which is exactly why all of this is really important. Dr. Harris, thank you so much for being here and joining us today, talking to us about dizziness and balance issues.
Thank you so much, Dr. J.
All right, guys. Well, there you have it. For more information about today's segment, or information about Dr. Dave Harris and St. Louis University, please visit my website, drlanajoseph4.com.